Welcome to CareConnections Quick Tips. Let's look at what we do when someone comes for an evaluation and the patient drops off. Whether they've come for another visit or not, they've not gotten a secondary, an interim assessment, a secondary assessment, and so we don't have any data for them and they're not returning. So what we'll want to do is double click into the patient record and you'll see that we have an evaluation on file and some data, but we don't have a second assessment. And we'll just click Next to get to our discharge puzzle piece. And there we'll enter the date we're discharging them, and we'll check this box that says patient self-discharge or no discharge assessment collected. And so we have a great report that's a self-discharge report because these folks are money walking out the door, so we want to keep an eye on them. And so we can select the reason, and let's say this person decided they didn't want to pay for their copay or something along those lines. And then they came in for just one visit or maybe a couple of visits. And from there, we click Save and Close. So because we have a complete file on them and we've discharged them, you can see their phase is now discharged. We can see the date of their intake, and then we can see their discharge date. What happens with these folks is that they're removed from your treatment registration list at the end of the quarter, and their data is included in all of your reports. You can always head over to this advanced search if you want to look up a patient in the past, but we want to keep your treatment registration list as clean as possible. So keep an eye out for those drop-offs. Make sure you discharge them out of the CareConnections system so they're included in your self-discharge report and aren't cluttering up your treatment registrations. As always, if you have any questions, please email us at support@careconnections.com.